Good evening and thanks for joining us. Please welcome to our COVID-19 update. I am Ladi Akiriduluale. Here are the highlights at this hour. Federal government says Nigerians are their own frontliners in the fight against COVID-19. Personal responsibility remains critical. Compliance levels with COVID-19 prevention guidelines remain extremely low. Rising case numbers is the result, according to the experts. And Egypt will reopen its airports on July the 1st. The federal government is appealing to Nigerians to adhere to the guidelines and measures so as to stem the spread of COVID-19. The Secretary to the Government of the Federation and Chairman of the Presidential Task Force on COVID-19, Mr. Boss Mustafa, during today's media briefing in Abuja, says the choices Nigerians make will determine how effective government policy will be. Mr. Mustafa says healthcare workers have warned that they are no longer the frontline workers, but the last line of defense, and that everyone is now a frontline worker with the responsibility of protecting one another.
We have gotten to a stage where no amount of enforcement will cut this through for us. It is the choices that we make that will determine what will happen. The governments subnational entities will try to do their best. But it is the choices of the people that will determine how effective that will be. Looking at that clip from the Czech Republic, you didn't see government officials around. You didn't see policemen or military people around. But by the conscious decision of the people, they decided that the entire country turned into a tailoring institution, and they began to produce face masks in large quantities, because they realize that if we apply this in addition to other non-pharmaceutical interventions, the likelihood of reducing drastically the rate of transmission will be achieved. And that's the consciousness I want us as a people, as Nigerians, to get to. That we are the only ones that can work assiduously to ensure that we reduce the level of transmission now that it's been seeded in our communities.
Meanwhile, as the figure of reported cases now is more than 16,000 in Nigeria, the coordinator of the Presidential Task Force on COVID-19, Dr. Sani Aliu, has asked governments at all levels to engage the people so they will be aware of the risks associated with the spread of COVID-19. Dr. Aliu says proper engagement with members of the community will ensure consistency with compliance with the guidelines put in place. Dr. Aliu was speaking at today's briefing of the Presidential Task Force on COVID-19 in Abuja.
But personally, I believe that the only way you can really ensure behavioral change is by engaging with people, by convincing people about their risk perception, changing their risk perception so that they are aware of the risks that they are facing. We cannot enforce people to wash their hands all the time. We cannot enforce people to wear masks in high-risk situations, even if we say, okay, on the roads, we will make sure you're wearing your mask. Well, what about in other places where law enforcement is not there? So I think the key process for making sure that these guidelines are followed is proper engagement of the communities, making people aware of the risks, personal and collective responsibility for our own health. And that way we'll have consistency. Because if I wear the mask today because there's a policeman outside my house and tomorrow I peep out and the policeman is not there and I leave without a mask, the whole purpose is defeated, because I can then transmit to somebody else. But if I know that that risk is there, I need to protect myself regardless of whether or not you have law enforcement around. You will do the right thing. And this is This is really the approach that we are putting forward.
We're about halfway through phase 2 of the eased lockdown, and as the country gears up for further action, our next report by Kayla Megwa looks at how residents of the nation's capital have complied with health advisories during the eased lockdown period and the impact this has had on compliance levels as well as the fight the country has against COVID-19.
The eased lockdown was adopted to save Nigeria's economy, especially to ensure food security. At the time, it was a consensus that no country can survive a total lockdown.
As much as the lockdown has achieved some result, it will not just make a complete economic sense for us to continue 100% lockdown as we have it now.
The eased lockdown put the responsibility of keeping the people safe from COVID-19 solely in the hands of Nigerians, while the government tried to enforce the 10 p.m. to 4 a.m. curfew and the ban on interstate travel.
You can't carry them from Benin, go and drop in Zaria. That other one carry Kanu, drop for Kogi. We can't do like that. It's not right.
After various challenges with places of worship breaking the non-congregating rule, churches and mosques were allowed to open with many conditions, which were adhered to by many, but with a few exceptions. As the ease continued, we saw people go back to their normal lives with no regard to the guidelines of the ease lockdown. In fact, many people began doubting the existence of COVID-19.
People don't really believe. Because when you look at it critically, the area that I stayed, you realize that as big as the place is, there is no, you don't even know anybody that is suffering from COVID-19 or thereabout.
Go out and ask your friends, have you seen a neighbor or have you seen anybody in your place of work, maybe who has died or maybe his friends or relatives has died of? They will say no.
Nigerians believe in what they see. So the government needs to come out and tell Nigerians, we have this number of cases. These are the locations.
Adherence to wearing face masks in public reached an all-time low, and transporters went back to overloading their vehicles. The eased lockdown came with a few scandals as well. Naira Marley somehow held a concert in Abuja, flying in with a private jet despite the ban on interstate travel, which led to the sealing of the Jabi Lake Mall and prosecution of the management of the venue.
There are even agreements signed by the ministers since last year, 8 months ago.
Despite pleas from the Speaker of the House of Representatives, the National Association of Resident Doctors embarked on an indefinite strike action over poor medical infrastructure and unpaid salaries and allowances.
The NEC resolved to proceed on an indefinite nationwide strike action from today, the 15th of June 2020, by 12:01 a.m.
Medical personnel treating COVID-19 patients are exempted from the strike action for the next 2 weeks, after which they're instructed to join the strike. The government has promised to pay those allowances immediately. It has been an eventful eased lockdown, but it's done nothing to reduce the spread of the disease. Compliance levels have been at an all-time low across board, and the rise in cases and deaths from COVID-19 in Nigeria continue.
Kayla joins me now from our Abuja studios. Good evening, Kayla, and I guess it's more important now than ever to say, hope you're keeping us safe, because it does look as if quite a number of people, particularly where you are not. Why is it that almost 16 weeks after the index case of COVID-19 in Nigeria, there are still people who say that they must see it to believe it?
Good evening, Ladi. It's one of the most troubling situations, to be honest. We've seen the numbers continue to rise. And we're not just talking about numbers of infections, we're talking about numbers of deaths as well from this disease. But with the rising numbers, you would think that people would be more careful, or would adhere to the guidelines that have been set, to keep themselves safe. But it's a very strange situation where we see people not even believing the numbers. Many people are asking, what we did, of course, is a roundup of how the past 3 weeks have been. What are some of the things that we've noticed? And one of the things that we noticed is that many people don't believe that this disease is out there. Some people think it's some kind of, some kind of scam, you know. Some people are asking, almost everyone that we spoke to, Ladi, was saying, I don't know anyone who has this disease. I don't know anyone who knows anyone who knows anyone who has this disease. And the government isn't helping me because they tell me that there's a number here, but they don't tell me where those people are located. They're not giving me names. They're not giving me actual locations. So how am I supposed to believe it? You know, I don't quite understand the thought process behind that. However, it is what it is, Ladi. That is the situation on ground. And you know what's so troubling about this is that as the weeks go by, we see the compliance levels to the guidelines. These guidelines are not supposed to be there because the government hates Nigerians. The guidelines are there to help you protect yourself. And we see these guidelines being flaunted constantly. People have even started making fun of people who wear face masks. It's actually gotten to where if you're sanitizing your hands all the time, or if you're trying to, like you go to a supermarket, for instance, and then you're trying to keep a particular distance between you and the next person, they look at you like something is wrong with you. So if this continues, I don't know how that's going to portend for the fight against, you know, COVID-19 in the country, because these guidelines are supposed to keep us safe. If we're not adhering to these guidelines, then we're basically putting ourselves out there to get infected. And remember, Ladi, since the ease of the lockdown, the numbers of infections have continued to increase, and so have the number of deaths in Nigeria from COVID-19.
Indeed, you're correct, Kayla. Thank you so much for your reporting. As our next report is going to show, it's not only in the nation's capital that is a challenge. Thank you very much, Kayla. Now, compliance to advisory measures put in place to further prevent a spread of COVID-19 is now a major challenge in Jigawa State as it opens up its economy. Markets are allowed to operate as usual, but the government insists that the use of face masks in public places is mandatory. But many seem not to understand the importance of these measures. Our correspondent in Dutse filed the next report, which assesses the level of compliance in the state.
Things seem to return to normal in the state capital after the state government lifted over 3 weeks lockdown in Dutse, Jigawa State. The State House of Assembly, which was under a necessary recess, returned with a different style. All lawmakers now have to wear face masks in the House. The situation is also the same in the courts, as all lawyers compulsorily put on their face mask in and around the courts. Markets are now open and activities are going on as normal. But a visit to Shuarin Weekly Market shows low compliance to the measures set aside to prevent further spread of the virus. Not a single person is wearing a face mask and no provision of hand-washing facility. The traders in the market say they were not provided with any. As such, they feel it is not necessary. Why should we wear any face mask? Why do we have to wash our hands all the time when we didn't touch anything? You only do that for a reason, and we don't see the need to do that. As you can see, not a single person is wearing a face mask in this market. The government did not provide that, and our market leaders didn't provide as well. Mr. Musbar Basirka, a civil society representative in the state task force, believes the major challenge in the fight against the spread of the virus is people's ignorance to COVID-19.
Most of the citizens are not believe there is anything corona in existence. So we're having challenges in educating and enlightening the people to believe that the corona is real and it still exists.
Government says the suspension on the ban on market activities comes with terms that if not complied with, it might reconsider its decision.
People must wear masks while in the market. That is number one. And then number two also, they have to observe hygiene within the market.
While the government continues to ease the measures, it is expected that the public understands the risk of not complying with the protocols and guidelines.
Members of the Presidential Task Force on COVID-19 have repeatedly asked Nigerians to take ownership of the COVID-19 response by following the safety measures. But how much of behavioral change have Nigerians embraced, and how can every Nigerian take responsibility for curbing the spread of coronavirus? I'm being joined on the program via Skype by a public health physician and epidemiologist who is of the Department of Community Health at the Obafemi Awolowo University Teaching Hospital in Ile-Ife, Osun State, Dr. Olukemi Olugbade. Good evening, Dr. Olugbade. Thank you for your time.
Good evening, sir.
Yeah, we are, of course, witnessing this. We are witnessing this low compliance in very many parts of the country with these guidelines, particularly following the easing of the lockdown. Is there any rational explanation for why people are aware of it, but yet they are not complying?
So at the beginning of the outbreak, there was a lot of panic, anxiety, and fear. And at that time, the number of cases weren't many. And it was surprising that as the number of cases increased and as the lockdown was eased, Nigerians reduced their level of compliance. And I think it's just fatigue. A lot of people had been indoors for a very long time. Their source of livelihood and income had been sort of put on hold. And now everybody just wants to get back to their business, making money, providing for their households. And so compliance is very secondary. However, we need to increase our risk communication and community engagement to let people know that COVID-19 is real. It is not a scam. It is a life-threatening condition and it is preventable. The standard precautions still apply: hand washing frequently for 20 seconds, cleaning of surfaces, maintaining social and physical distancing, staying at home when one doesn't have to be out of the house, and also for now, avoiding mass gatherings. Though there are guidelines that the NCDC has laid down for places of worship and several states too, for places of worship who want to resume faith-based activities, but in as much as those restrictions have been reduced, all these precautionary measures must be maintained. So I think the reduction in compliance is just due to fatigue and because people have, they just want to get back to their normal lives and they're making the mistake of...
Dr. Olugbade, isn't that actually the point? That people cannot get back to, quote and unquote, their normal lives. There isn't any normal life to get back to. That's the point that the last couple of weeks, everybody has been trying, all those in authority and all those in the positions have been trying to get across that this is the new normal: face masks, social distancing, washing of hands, staying away if you're vulnerable, and so on. That's the new normal. So going back to normal life isn't on the cards.
So the thing is, this is our collective responsibility. The government has done a lot with coordination and engaging all stakeholders for a very good response, but the citizens still have their responsibility. According to the reports we just watched, and in several states across the country, people are not taking precautionary measures. And we can only continue to encourage people. There are people, I think the general belief is that COVID-19 is not real. And we have continued to tell people, community members, community leaders, our patients in the hospital, COVID-19 is real, take precaution. Fine, COVID-19 is the new normal. But that is, a lot of people, it seems very far from them because they are not seeing the patients. They claim the figures are being inflated. They are not seeing what is going on in the isolation and treatment centers. So it's like seeing is believing. If we don't see, we don't believe. And so let's keep on doing things we used to do the way we've been doing it. But that has to change. So we have to continue these conversations. We have to keep on encouraging people to do the right thing. That is why, NCDC has kept on reminding us on a daily basis, take responsibility. We need to take responsibility for our health. We need to take responsibility for our safety. And then we need to protect each other. The earlier we take these precautionary measures, the better, so that these cases, the number of cases can reduce and we can flatten the curve. And in working together and taking collective responsibility, then this outbreak can be over. Fine, we're in the COVID-19 era. Okay, it's changing the practice. Now you have to consider COVID-19 every time you see a patient in a hospital. a patient is coming with a fever, in fact, you would have to put that as your list of differentials. It's the new normal. We have to keep on encouraging people to do the right thing. However, there is fatigue, and so we can only keep on encouraging people. We can only keep on reminding them, and it's just the stage we're in now, and we just need to take responsibility.
Thank you very much, Dr.
Really,
Olukemi Olugbade of the Department of Community Health, Obafemi Awolowo University Teaching Hospital in Ile-Ife, Osun State. Thank you so much for your time this evening. It's been a pleasure having you with us.
same here. Thank you.
We'll take a break, and when we return, we'll bring you the very latest of the cases and the statistics concerning the COVID-19 in Nigeria. Do stay with us. Thanks for staying tuned. Welcome back. With 403 COVID-19 cases recorded in the last 24 hours, Nigeria's total confirmed coronavirus cases now stands at 16,085. A total of 5,220 patients have recovered from the disease, and the death toll is now at 420. That brings the number of active COVID-19 cases across the country to 10,445. A breakdown by region shows Lagos State in the southwest with 7,103 cases. The Federal Capital Territory, Abuja, recorded no new case, but leads in the north central with 1,247 cases, while Kano leads in the northwest with 1,137 cases. Edo State tops the south-south with 580 cases. Borno State's 438 confirmed cases is the highest in the northeast, and Abia State displaces Ebonyi in the southeast with 166 cases. And staying in the southeast, so far Imo State has done 760 tests with a total of 136 confirmed cases of COVID-19. The state has also recorded another death, making it 2 so far. Our correspondent, Itokwe Kutei, gives us details of the happenings.
The reality that COVID-19 is a deadly disease is getting clearer by the day, especially for people who think it's not real. The chairman of the COVID-19 task force in Imo State, Professor Morris, who today confirmed another death owing to complications from coronavirus disease. This time the case is of a pregnant woman who delivered a set of twins but couldn't make it. She was said to be receiving treatment at the isolation center here in Owerri after testing positive to coronavirus disease before she delivered her twins. Fortunately, samples taken on the twins came out negative.
Yeah, the woman had a set of twins, and then we thought she was doing okay, and then but she could have died of so many reasons. People die in childbirth, but she made through the childbirth, and then this didn't happen. So it's one of those comments. But if not for the purposes of actually announcing the fact that so that people know that this is real. Otherwise, something is so personal, you don't want to complicate matters for the family concerned. You keep it to yourself.
On the nationwide strike embarked upon by the National Association of Resident Doctors, the resident doctors at the Federal Medical Center Owerri have joined the nationwide strike, calling on the government to meet their demands, especially during this pandemic. From Owerri, the Imo State capital, Itokwe Kutei for COVID-19 update.
As you heard from Itokwe Kutei in that update, resident doctors have indeed embarked on a nationwide strike in the middle of this COVID-19 pandemic. Well, to tell us more about the issues that propelled the doctors on this industrial action, I have with me in the studio here the second vice president of the Association of Resident Doctors at the Lagos State University Teaching Hospital in Ikeja, Dr. Aziz Ojekunle. Dr. Ojekunle, thank you for your time. Thank you for coming in.
Thank you, sir.
On May the 30th, there was a 2-week ultimatum given.
Yes.
In between those 2 weeks, several government officials had given assurances that the money and other things that the doctors were asking for were being done, and had in fact up until today, even today, the health minister, Dr. Ohanire, said that in conversations with the leadership of the resident doctors, they had done everything and that the money was going to be paid, particularly that had to do with money. PPEs had been supplied to all the states and so on amongst the demands, because I'm looking at the demands of some of the things that you have here. So what are the outstanding issues?
Thank you once again. It's glad to be here. Thank you for the opportunity for us to hear our demands to the general public. This has been a recurring promises in the past 4 years. This is a lingering...
4 years?
Yes, sir. Since 2016. It's been a lingering issue from tenure to tenure up to date, culminating into issuing of ultimatum of the 14 days to the present moment. These are the promises that we've been hearing, even some in black and white, but yet we are yet to have concrete evidences to provide this. They say that private protective equipment are available, but we don't have them in our facilities.
Even up until now?
Yes. We have there, at some point, they're talking about rational use of PPEs. Even some of our members that are tackling patients directly they are being exposed without being protected. These are what has been said in the social media that, okay, they've provided, but we don't have them yet. About the monetary provision,
yes,
that is yet to be provided at the federal level. These are promises that we've been hearing over and over again. Even at the state level, like in my center, the Lagos State University Teaching Hospital, we are yet to have this monetary remuneration domesticated in our center. There's this COVID-19 hazard allowance that was being proposed by the federal government. That is yet to be made available to the state institution like ours and even across the nation and in the federal level. None of our members is yet to get confirmation of that monetary remuneration yet as at now.
Because among the demands that you have here, there's the issue of stoppage and immediate refund of all illegal, unjust, and callous cuts in salaries of our members by the Kaduna State government and other state governments. Had there been any movement on that?
There is always the promises yet. That is still what is still in court. We've received promises, but they are yet to make that implemented. Our members in Kaduna State, in Kogi State, who were illegally disengaged, are yet to be called back. There is yet to make...
When you say illegally disengaged, what do you mean?
When in the training service, there are protocols, there are procedures by which after completion of the residency training, you can disengage. There is the Medical Residency Training Act, which is being passed by the National Assembly. That was as far back as September 2017, passed by the Senate Chamber in December 2020. And the President of the Federation, President Muhammad Buhari, signed this into law in June 28, 2018. This is yet to be implemented. It's meant to be a standard protocol, a reference whereby the residency training will be followed. One cannot just disengage our members illegally. That is illegal disengagement in the midst of this COVID-19 pandemic. Even likewise in lawsuit, we are yet to get the remuneration. Across the state teaching hospital, tertiary hospital across the nation, they are yet to get this remuneration, even in federal government. And that brings us to the issue of the gross disparity in this, the salary remuneration between the federal teaching hospitals and the state teaching hospitals. There is the need to harmonize this remuneration. The difference is quite significant. Members are getting underpaid, especially in this pandemic, where there is financial implications to this. There is an emotional attachment to this also. Members need to be well remunerated, not only in the federal institution also, likewise in state teaching hospitals across the country, and especially in Lagos State, because as at now, as you quoted earlier on, as at yesterday, we have active cases in the country of 60,085 with 420 deaths. I can assure you right now in Lagos State, we have, as of yesterday, 7,103. That contributes to about 44.2% of the nation burden of COVID-19. And most of these cases are detected in health centers, in general hospitals. They get eventually referred to state teaching hospitals in lawsuit in our center, likewise in Lutz and other centers. We are being exposed, but we don't have our minimum demands. We need private, PPEs, yes, to be provided. We need harmonization of salaries between the federal and state teaching hospitals. We need provision of implementation of the Medical Residency Training Act, both in the national and likewise across the state government. And we are calling on Lagos State government to come to our aid. We need this to be implemented for smooth running of healthcare delivery, not only in the state, across the nation, so that we can be at least at par to our other contemporaries, even in Africa, not to even talk of the global world.
So, something that would interest a lot of people is that for now, for 2 weeks from today, if these demands are not met, your colleagues who you've exempted so far, who are in direct contact with the treatment of COVID-19, which is the pandemic, will join you.
Yes. This joining, should the government not respond with concrete evidences to show their commitment The joining of our members in COVID-19 treatment and isolation centers is quite inevitable. This is an unfortunate scenario. As much as possible, our members across the nation, across the states, and in lawsuits have been hesitant to commence this strike. However, because of the insensitivity of government to our plight, to the situation of the healthcare structure across the country, the strike becomes imminent. It becomes inevitable, and we have to commence it. However, we take cognizance of the fact that our patients in the COVID-19 treatment center and isolation center need to be treated. That's why we've exempted them for these 2 weeks. But following the 2 weeks expiration of these 2, if there are no responses from the government, we are ready to negotiate and put an end to the strike as long as we have concrete evidences from the government and relevant stakeholders. However, should this not be provided, our members will have to join, and that will be a total and indefinite strike, has been stated by the...
We hope it doesn't come to that. Dr. Aziz Ojakule, thank you so much for your time this evening. Thank you for joining us.
Thank you, sir.
Let's go to Ekiti State, where the closure of the main markets seem not to have fully served their purpose, as it's observed that traders have occupied the roads leading to those markets. So as it is, big markets are officially shut, but market activities are still taking place within the same axis with a crowd not too okay for physical distancing. Babajide Agbeyo has details of this and more.
The free road you can see behind me is the popular market called Ojabisi in Nado, the Ekiti State capital. The market was decongested in the wake of COVID-19. But the next road you're going to see, that's the road leading to the main market called Ojaoba in Nado, Ekiti, now very congested. So it looks like a case of decongesting and recongesting, if you like. And the Ekiti people have their comments on this.
The social distancing that the government is clamoring about is not working. It's not achieving the desired result. Because if you can see, everywhere is crowded. So I don't think the social distancing being claimed by the government for us to obey can work.
You agree with me that when it comes to marketplaces, you cannot really observe that kind of social distancing we are really talking about, because it's a marketplace.
As for the use of face masks, some are fast forgetting the importance, but some are still sticking to that rule. A group has been coming to the market to sensitize street sweepers and passers-by on the importance of using face masks and keeping to other rules guiding COVID-19. And it is hoped that people will comply. Babajide Agbeyo for COVID-19 update.
In Bayelsa State, residents can be seen in public places without the use of a face mask. Our correspondent, Dobra Timewood, has more.
As the world continues to curb the spread of the coronavirus, over here in Yenagua, there's some cheering news from this isolation center at the Federal Medical Center. Out of the 32 confirmed cases of COVID-19 in Bayelsa State, 26 have already been discharged. The state presently has only 3 active cases and has recorded 3 deaths. Now, as amazing as this news is, residents of Bayelsa State are bothered regarding the strike embarked upon by resident doctors. Earlier in the day, we spoke with the president of the Association of Resident Doctors at the Federal Medical Center, and she says resident doctors make up over 80% of the workforce, and this strike they've embarked on would negatively affect the quality of service delivery that patients would have in the state.
We're thinking that during this pandemic, health will be brought topmost, and our health system that is decaying every day will be looked into, and things will begin to be put in their place. But I can tell you that it's getting worse. Nothing tangible has been done. See, the problem is that Nigerians should speak up. How can we be renovating a National Assembly with 27 billion naira and hazard allowance for people that put their lives at risk, their families are at risk, cannot be paid a token? It's not just about the money, but this cry is that let us fix the health system so that Nigerians will get better health care.
If a patient is sick, it is expected that patient should go and seek health care.
either in federal institutions like ours or other state, other general hospital, or also in other private facilities. For us in FMC, like my president said, the resident doctors constitute majority of the workforce, roughly 90% in terms of doctors. So the consultants, they are very few. What that means is that air care delivery will be reduced because they cannot be able to provide the effective healthcare service to Bayelsans that are present at FMC because they are few. That's why we are calling on WMI Nigeria to see how this issue can be sorted out so that resident doctors can come back and render selfless service to humanity.
We've also noticed that the consciousness to avoid the spread of the coronavirus has reduced amongst residents of Bayelsa State. We've noticed a low usage of the face masks, and people readily go to crowded area without following the laid down guidelines to avoid the spread of the virus. From Yenagua, Dobra Timiwood for COVID-19 updates.
From Bayelsa in the south-south, we return to the southwest state of Oyo, where the state government has relaxed its lockdown procedure, changing the curfew period from 8 p.m. to 5 a.m. to 10 p.m. To 5 a.m. Pupils in primary 6, GSS3 and SS3 are to resume on the 29th of June, while the secretariat, which has been partially open, would be open to all cadres of workers by June the 22nd.
The Association of Resident Doctors have embarked on a nationwide strike, and the agitations are so many. But chief among this is the fact that the fault lines exposed by COVID-19 pandemic gets deeper and deeper each day, and most of them are at the receiving end of those lines. They have lost not less than 10 members, according to the chairman of the Resident Doctors Association here in Oyo State, to COVID-19 since it started. They do not have enough protective, personal protective equipment, PPEs, across the hospitals in the country, and so many other issues that they are agitating about. We spoke to the ARD chairman in Oyo State earlier on.
We hear a lot of billions being voted for COVID, but those things are not visible in the hospital. We don't have personal protective equipment. We're not having enough or more ventilators for those that need ventilatory support. And even the doctors are not getting any COVID-19 inducement allowance. Doctors, in the last, since the beginning of COVID, we've not lost less than 10 resident doctors. We've had about 825 resident doctors who have come in contact with COVID, and we had about 245 that have actually been positive to COVID-19. So this tells you that doctors are now, it's a high-risk profession, and the inducement allowance that is being promised by government has not been paid.
Life for so many seems to be returning to normal, but normalcy is still far away in this pandemic. And caution has to be taken by everyone involved. Bukola Oriowo for COVID-19 update.
Outside our shores, it's not only non-compliance that is a problem, but plunging temperatures as lockdown level 3 regulations still worry the government as number of confirmed cases surge. We're talking, of course, of South Africa. Our Johannesburg Bureau Chief, Betty Dibia, is here with more. Betty?
Good evening and greetings from Johannesburg. South Africa has recorded a surge in the number of new confirmed cases in the past week, crossing the 70,000 mark at the weekend. The death toll is over 1,000, and most of that is from the Western Cape, which is still the epicenter, and it's followed by Gauteng province. And just a week after the reopening of schools for grades 7 and 12, more than 40 schools across the country have been forced to close as a number of students and teachers have tested positive for COVID-19. We understand that some of the schools may be reopening, but many parents are worried about this, with the umbrella students' body, COSAS, demanding that all schools be closed down. Meanwhile, compliance to anti-COVID regulations still remains a problem in many communities, and more so since the country moved to level 3 lockdown. From cigarette ban protesters outside Parliament to alcohol abusers in several parts of the country.
We are looking at the alcohol thing. We know since it came up, there are people that they don't want really to comply, and those that are going to doctors' shops still have to explain. So we still have to explain. Though it's really a little bit relaxed, but we still do find the people that they don't know which direction are they going, and those people should be told to go and comply with the regulation that you still have to stay home. The COVID-19 is still with us.
And the aviation sector came alive this Monday as a number of budget airlines operated flights from Johannesburg to Durban and Cape Town this Monday amidst very strict regulations. And beyond COVID, South Africa is currently grappling with a wave of very heartbreaking murders in different parts of the country of mostly women. The latest being that of a woman tied up, stuffed in a bag and left along Johannesburg Highway, as well as that of a male 28-year-old choreographer who was stabbed to death by a 14-year-old girl in the Western Cape. Speaking to the nation this evening, President Cyril Ramaphosa says that the culture of silence over gender-based violence must come to an end as the government continues to strengthen the relevant laws to tackle this. Back to you.
Thank you, Betty. Let's cross from South Africa and go into Europe, where Juliana Olainka, our correspondent in London in the United Kingdom, now joins me. Juliana, it's been a little bit of a while since we spoke on this program, and I'm sure there's quite a bit happening in the UK. Let's start off from the fact that it does appear that in the case of the UK, the easing of the lockdown hasn't quite translated into the kind of problems that we have talked about in other places. But there is still a challenge there, hasn't there been?
There is, Laddie. Thank you so much for inviting me back. I definitely would say that Britain has entered into the third phase of lockdown. So from today, non-essential stores were open. So all of the famous department stores that people know about on Oxford Circus had queues and queues of people outside. Primark, Selfridges, H&M, Niketown. It seems as if Britain, well, particularly Londoners, were desperate to get out and spend their money, which is exactly what Prime Minister Boris Johnson would want, because as most people know, Britain is in a deep recession. We just had GDP figures last week showing that since the lockdown, we've lost quarter of our GDP, which is absolutely immense. So Prime Minister Boris is urging people to get out on the street, and he has to urge people because it is one of the phobia nations on earth. We're not like our European counterparts. It hasn't been easy to just let people back out. Schools opened a couple of weeks ago. Only 7% of parents let their children back to schools because there are still fears that they could catch the coronavirus. So they are a little bit worried. Perhaps the government message was so strong, people believed in those words so much that they don't want to go out. Also, as well, we can't forget that we are still the third highest affected country in the world. Today was still one of our lowest figures. I believe 36 people died today, which brings the entire total to over 52,000. So there are still concerns. But, you know, our studio is in the dead centre of London. And when I was out and about, I definitely was surprised to see so many people out queuing to spend their pounds again.
That brings up the question of all this frenetic activity, economic and otherwise, and the issue of the measures put in place, the issue of masks and social distancing in particular. How has that gone?
Well, it's a major issue at the moment. First of all, Sadiq Khan, the Mayor of London, has made it absolutely mandatory for everybody travelling on public transport, be it a bus, an Uber or a tube, that you have to wear face masks. So again, that's what you were seeing. It definitely felt as if it was normal, but it's not. It's a new normal, and everybody had to wear that. In fact, there were lots of police activity at stations, because if you didn't wear a mask, you wouldn't be able to board a train, and you would also be subject to a fine. So that's first and foremost. And I believe there are some reports suggesting that that could be in place for about a year in the UK. The other thing is the hospitality sector. Britain is a services economy. It relies on that. Hospitality is still not open yet. It won't open until at least the 4th of July. But there's lots of pressure coming from business lobby groups, MP backbenchers, and business owners who are saying it's going to be absolutely impossible for them to open their doors with a 2-meter distance. So now there are so many calls for the Prime Minister and the government and the scientific community working around him to publish the facts that say that we have to adhere to the 2 meters, because they think it's just going to be impossible to run a business without it. But I have to say very quickly, there are fears of this second wave. We're seeing a second wave of infections in China, in Hong Kong, in Iran, in America. Britain is very high up that. So the World Health Organization are saying it's all well and good opening up the country again, but you've got to be careful, because the disease, the virus, is still running rampant in the UK.
Well, one would only wish that the new normal sits well with most of the citizens, and they make the adaptation quickly. Otherwise, the consequences might be quite dire. Juliana, thank you so much for that update, and do stay safe out there, even within all the frenetic activity of people coming out of lockdown. Thank you so much.
Thank you.
The U.S. Food and Drugs Administration has revoked emergency use of hydroxychloroquine as treatment for COVID-19. The FDA says, based on latest evidence, it was no longer reasonable to believe that taking hydroxychloroquine and the related drug chloroquine could be an effective treatment for COVID-19. Elsewhere, countries in the European Union today reopened their borders as part of easing lockdown measures.
Reopened all its airports on July the 1st after suspending regular international flights in March due to the outbreak. Flights would resume gradually, and the foreign tourism would be limited to resorts in 3 coastal provinces. And in Beijing, residents are back on alert after rise in new coronavirus cases. The city reported its second consecutive day of record new numbers of COVID-19 cases, adding urgency to efforts to rein in a sudden resurgence of the virus in the Chinese capital.
Taking responsibility by adhering to recommended measures coming from the health authorities, that's the message from the Nigeria Center for Disease Control, the NCDC. The NCDC website has more information on the COVID-19 national response. You can find the latest national strategy to scale up testing and other public health advisories on COVID-19 on the website. The World Health Organization has the latest updates on the global response to COVID-19. The WHO website guides the public health response at national and sub-national levels, including practical guidance for strategic action. Our website, channelstv.com, has more updates. You can find the latest on the pandemic in Nigeria and across the world, plus the details of other stories in politics, sports, in business. Thank you for watching our COVID-19 update tonight. I'm Ladi Akiredoluale. Good night.